It's really a very interesting and strange thing, and actually we don't know how it works. I'll even just describe what it is. You don't have to do it. I'm just talking. I'm just talking. No, you're the boss. We work for you. This is a process where it actually connects someone to this weird little machine. It takes out some white cells. We take that little bag of white cells, we put a chemical in it, which is actually a chemotherapy drug. But the drug doesn't do anything, it's inert unless you expose it to ultraviolet light. So it's really weird. Collect a small bag of the patient's white blood cells. We put this drug in it, and then we expose that to an ultraviolet light. That activates the drug that we put in there, and then we transfuse those cells, your cells, that we treated with this drug, back into the body. And then those cells that have this chemotherapy somehow connected to it attack the skin problem, and it works both for cancer of the skin, T-cell lymphoma, and it also works for graft versus host disease. And one of the hard problems for you, and it's very frustrating for us and for you especially, is it's hard for us to tell when it's leukemia and when it's graft versus host disease. And then what's really hard is someone like you who's had a transplant and has lymphoma can have both of those things. So it's like really difficult. You do biopsy after biopsy and it comes back and you go to the patient and it's like, I think it's this, and they look at you and it's like, not for nothing, doc, but I'm not interested in what you think. You have to tell me what you know, and we have to admit there's limitations. What's cool about this treatment is it should work for both of the things you have. It's not experimental, it's something we do regularly, it's just rare because what you have is rare.
That's what I have. I would like to know what I have.
You have a rare form of leukemia lymphoma, a cancer of the blood system called adult T-cell leukemia lymphoma, and we really only see it in Caribbean, South American people, and in Japan. And that's because it's caused by a virus that's very common in the South American Caribbean basin. The reason we have so much here in the Bronx is we have a big Caribbean population. In fact, Montefiore probably sees more of this lymphoma than anywhere in the world, just because we have such a big Caribbean and South American population here. The other place it happens weirdly is in Japan. We think that's because it's an island nation and over history nobody could really leave because they were stuck there. But it's different in Japan than it is in the Caribbean and in New York. The two places in America that we see this is in Miami. There's a lot of Caribbeans in Miami, and in New York City, particularly in the Bronx. I think we have more than anybody else. We just met with a doctor at Columbia who's working on this.
Can I say something?
Yeah.
Quick?
So then the other thing is, what do you do for it? You try everything. You try topical stuff. You try pills, IVs. We try to figure out anything that we have. We want to try, but it's a lot of times kind of a uphill battle.
I was told that I'm the only case here in America.
No.
So what that's referring to is that you might have gotten this from your brother's stem cells. It's not the only case ever described, but that's pretty rare. When you have somebody that has leukemia and you do a stem cell transplant, you're trying to give them a new immune system, in this case from your brother, to attack the cancer. To then develop a cancer from the brother's cells, I admit to you, that's rare. Do we see it? Very infrequently. Why did that happen? I don't have any idea. Maybe from this virus also. It's very hard to understand. So in that sense, you're very unusual. But you have to remember, you're very unusual in another way, which is how many people in the world, or in the United States, get a stem cell transplant for ATLL? The ones that get it pretty much come from Montefiore and a couple other places in America because it's a rare cancer. I have in my own practice about a half a dozen people who are cured from your condition, and all of them got stem cell transplant. It really seems to be the only effective way. So what's horrible, and none of us understand at all, is why does a young guy who's strong, who actually goes through this transplant, end up getting cancer? It's terrible. I don't understand that at all. I feel really like upset about that. Everybody does. So we have to get you feeling better. Skin is the worst, one of the worst sufferings. In fact, you don't need me to tell you, people have committed suicide from severe itching because it's so terrible.
Trust me.
What we need essentially, in my approach, is to try like 17 different things until we get you better. Some of them are directed at the process itself, like steroids on the skin or this fancy chemo blood thing I just talked about. Some of them are just to soothe you, calamine, other things. But you need combinations. There are, for people with refractory pruritus, which happens sometimes in Hodgkin lymphoma, you can see severe pruritus. There's been documented suicides. There's some weird things you can do, mirtazapine, like if you look at the dermatologists, they have lists of crap that they'll do, even fosaprepitant, weird things. So I don't know what's been tried over the months and months for him, but we should just throw the kitchen sink approach here. And that doesn't need to be in the hospital, by the way. That, you know, if you came to my office or Alex's, I would be giving you 5 things and being like, let's just try everything. It's just the only way to try. I see how frustrated you are. I think I would be more frustrated even than you are.
I did 3 biopsies in 2 months and they come back, I don't have cancer. And you guys want to treat cancer, that's what frustrates me more than anything.
It'll also treat the graft versus host. So what the
I
biopsy
don't have a
showed.
graft host. That's what that's what I heard. They told me the thing read. I do not have a graft host disease,
If you lose
and
your
I do not have ATLL.
If you
right?
lose your
so they're
allograft,
telling me,
and you have graft versus
bro,
host disease?
I can't get I can't talk.
Sorry, I'm sorry. What's it called?
Jesus Christ.
That's my fault. Go
Can I
ahead.
tell you?
Yeah, go ahead.
So what they found in the biopsies is they found a lot of T cells in your skin. Now they tested those T cells and they weren't cancerous. Now they said we can't prove that this isn't graft versus host disease. Some of them looked more reactive, like it was more related to the T cells, but they couldn't prove it wasn't. Now the T cells that they tested in those were not cancerous. So they were leaning more, they saying it could be graft versus host disease, but we can't prove it.
Right.
So we wanted to do something that would treat everything it could be.
Right. But in my case, brother,
Mm-hmm.
I fight cancer 2016.
Mm-hmm.
So you know I use a lot of chemo and a lot of drugs.
Mm-hmm.
2021 again, I did chemo and all that stuff. So that's a lot of more drugs also in my body. I did a lot of CAT scan, PET scan.
Mm-hmm.
So you know my body is already like drained out.
Yeah.
Right? So hold on,
I'm
man.
sorry.
So if you guys gonna treat me for DVHD and cancer at the same time,
Mm-hmm.
how could I withstand that type of treatment, man? After I've done been burned out, I need to know what I'm fighting so I could fight that specific problem. I don't want to keep hoping on my mind. All right. So for instance, you said we're gonna try this stuff. I go and try this stuff and they don't work. So
Everything we do is try.
so it basically is like I put some more drugs out through my system, and then I still gotta go seek for some more type of cure, right?
Can I
Yes.
talk about? Well,
No, yes is the answer, yes.
but there is some differences.
Yeah.
So when we do this electrophoresis, we sit there and we do it in the sunlight, in the cells outside of your body. That's specifically why Dr. Sika picked this,
It don't make you sick.
because essentially we take the cells out, we treat them outside your body, and then we put them, now treated, back in. So all the light therapy, all the chemo drugs, all of that happens outside of you. And then they go back in and then can kill those T cells and can activate your immune system. So you're not going to be getting systemic chemo through the
It
vein.
won't make you sick like
It won't
chemo
make you
does.
sick, and it won't add to the toxicities that you had beforehand.
How you get those cells?
What?
How you get those cells? How you treat those cells?
We take them from your vein.
Yeah, you gotta. So
Yeah,
I gotta
take
take
them
that.
out.
I gotta take the shots that take
No.
that injection that.
Good
shot.
question, no, not like that. We just
Oh,
have
that
to-
works.
You just remove it. In fact, we need a pretty good IV. Question we always ask is, does the patient have decent veins where we
I
can
don't have
actually...
decent vein.
I
went
know, so
downstairs
that's
and
why
I
we're
you gotta
looking
put in
at-
a port.
We need to some
So
kind of
that
access.
costs for a port.
Yeah.
I just put a port in and I got it got infected.
Mhm.
Man, I've been through too much. I'm not even doing no port. I'm not gonna do no blood outside the world.
Okay.
I'm not doing none of that stuff. I wanna know what I got and I could fight that. I don't wanna try to fight something I don't have. You
So,
come back
but
that I
you-
don't
but
have
you're
ATL,
right.
then I'm
Everything
not
is-
fighting
No,
something
but
I
here's the
don't
thing.
have.
We're not saying the same thing. We're not saying something different. We're saying exactly the same thing. The first thing I said to you is, I don't know what's wrong with you.
Right.
And everybody, if you don't admit that, then we don't even have a place to start this conversation.
That's true.
We have to just tell the truth.
That's why I
Alex
respect you,
Sika,
brother.
me,
Yeah.
Mark, none of us know. What we think we've narrowed
Right,
it down
right.
to is either the ATLL or graft versus host disease or both. I'll throw you a couple of scenarios that the patient already said that call into question both of those things, and I'm going to do it as a teacher, if you
Right.
don't mind. He has said he's had CAT scans and biopsies and numerous approaches, and none of them definitively showed ATLL. I would argue that ATLL is not subtle disease. When that disease relapses, especially the leukemic form, it's rip-roaring, horrible, life-threatening leukemia, white cell apoptosis. Now the problem is that disease has multiple manifestations. Skin manifestations, smoldering forms, acute forms, all that stuff. Second thing, there's no way to accurately diagnose graft versus host disease. We already had that whole conversation. It's freaking immunological cells. So we have to say to this man, we don't know. You rightfully and very smartly said, well, if you're telling me I have cancer, how come when you come back to me with my CAT scan results, you tell me there is no cancer? How come when you come back to me with my biopsy results? So which is it, Doc? Do I have it or do I not have it?
Right,
Good question.
right.
Second thing is, and this is a thought experiment, if you relapse your leukemia after allogeneic stem cell transplant, you've lost your allograft. So how do you have graft versus host disease if you've lost your allograft? So I'll make that into a question. Can you have graft versus host disease if you have lost your allograft? And the answer is yes. Unfortunately, what happens in the acute scenario is someone starts to relapse their leukemia and they already had GVHD. The populations of T cells that exert the anti-leukemic effect are not the same that exert the GVHD. So we very often see people in full-blown relapse where we're trying to stop their immunosuppression, so we'll increase the GVL, and they already have graft versus host disease, and we can't. Over time, the GVHD should go away because you don't have those immune cells anymore. So when a smart guy looks at us and is like, guys, you're talking out of both sides of your mouth. 1 minute you say I have cancer, the next you say I don't. 1 minute you say I have graft versus host disease, the next you don't. The truth is, that's completely true. And if we don't start from there, we're not on the same page. So really, what you have scenario-wise is a simple scenario that repeats itself a lot, which is doctors having to just take their best guesses. At least the people guessing are people like Sika, who are kind of like worldwide experts. At least it's not some guy from like down the corner or whatever,
Yeah,
but it doesn't make it that much better.
Right, I asked 3 weeks ago. I had to do a food allergy test, and I'm still sitting in here all long. Somebody could have had me go and do a food allergy test. That's not
It's
so
hard to
difficult.
get that because they do injections.
Yeah, I
and
know,
all
but
stuff.
this is something
Yeah.
serious for a month. Even if it's hard, try.
We
Ain't
can
nobody
send
try.
you in their office.
Ain't nobody
They don't
try.
do it in the
If
hospital.
it's
We
even
can send
hard,
you to
nobody
that.
try, man.
Yeah.
That's what I'm saying.
Okay.
Nobody try. Why you didn't try to see if you could? At least if it's hard, then let me get.
We can,
Let it turn down.
in
Let
the
me get
office,
turned down.
We can
At least
definitely
try.
get you a
man.
referral.
It's
That's
like,
an easy thing to do.
look at my foot, man. It's like I've been sitting up. Look, see my hand. This is like I'm in discomfort, bro. This is like some bad drugs reaction.
When you see this, you can see how long it's been going on for. 'cause
I
of
already
how
took
thick it
off.
is
I took
back
off skin thick as
there.
my finger off
This
of
is
it already.
months. This is not days or weeks.
I took off skin off of this as thick as my hand already. Took them off. All these here, the skin came off. All
So what do you want us to do? We work for you.
you work for me?
Yeah, that's how it
I
goes.
didn't go to school for doctor.
No, but you're
I
the
just
boss.
know when people get sick, they go see the doctor. I'm here
So
for a
listen,
doctor
what
because I'm
saying-
sick. I didn't
no,
go to school
what I'm
for
saying,
doctor.
Mr. Bell, is we've made a couple recommendations, Dr. Sika.
Recommendation for something I don't even know what I have. That's
Well,
what I'm saying. That's why you
is
guys
if
should
you
go and
don't
figure out what
want
I'm fighting,
to
man.
do that treatment, what do you want?
What do I want?
Yes. In other words, I feel like you're handcuffing me.
God.
Because you're saying to me, doctor, what treatment do you recommend? And I say, I recommend this treatment. And you say,
Yeah.
I don't want that.
But
so
no,
I
no.
say, okay, what do you want? And you say, I don't know, you're the doctor.
All right, doctor.
Then we're going
listen.
full circle.
Listen, doctor, I know
Yeah.
you just made the right statement. You
Yeah.
said, for me to sit here and try to take medicine for something that I don't have, that would be ridiculous. Not because these are rashes and I had ATLL before, that means this have to be coming from ATLL. This could be a whole something I don't hate. It could be something I touch. It could be it could be from mole. It could be a whole bunch of different things. But you guys is only looking at one thing, man.
No,
and
that's not right. That's why
that's-
you did
that's-
3 biopsies.
Yeah,
That's
but
not true.
and the 3 biopsies, they still want to do a next one.
I know, but if it was those things you're describing, allergy, infection, mold, all that.
I'm
We
just
could have
saying,
very easily
I'm just
seen
throwing that out there. I'm just saying it could be anything. It could be something
But
else.
but
You don't have to be coming from
It
ATL.
can only be anything before you do a biopsy. Once you do a biopsy, you exclude that. If you want to say it's fungus, well, I don't see fungus, so it's not that. You want to say it's bacteria? No, I don't see that. You want to say it's viral? No, I don't see that. Is it allergies? Well, that's a tricky one because allergies and GVHD and leukemia can look very similar, but it doesn't. So to say, oh, it could be anything. No, you submitted to 3 biopsies. If you hadn't, then we would still be at the place you're saying, maybe it's 10 other things. But you have been a patient. You've been cooperative. You did 3 biopsies. And so we know a lot of things that it isn't, but that's not the same thing as saying we know what it is.
Can I tell, I think it might be helpful to say what the biopsy showed.
Good, I like
Yes.
that.
Because in the biopsies, they did see what's causing it. Your T cells are overexpressed in your skin. These are part of your immune cells, and there's a ton of them in your skin.
These are cells in the body that are used to attack. They're healthy. Usually they attack bacteria or other things.
Uh-huh.
Yours seem like they're attacking your skin.
Now, why is it doing that? That's the question. We know what's doing it, but why is it doing it? And some people are saying because it's his brother's T cells. That would be the GVHD.
Right.
Other people are saying, no, it's the cancerous T cells. He had the cancer in the T cells. That's why they're doing it.
Or both.
Other people are saying maybe it's the allergies. That's why they're doing it. So that's why now we tested those T cells to test them for the cancer. And the test for the cancer was negative, but it's
Right.
not a perfect test.
Right.
So we could be wrong.
Why it's not a perfect? I mean, no,
It's
it's not
hard.
perfect.
It's
It's
hard.
I said, yeah.
Because essentially you're only testing you're only testing the T cells that you get.
Mm.
So you've got T cells in your whole body, you've got a whole immune system, and you've got your brother's T cells, you got all different types. And the ones we tested were not cancerous.
Right.
But can we say that every single T cell, every single one in your body, that somewhere they don't have a mutation, that we
Right.
got everyone and tested every single, no, we can't.
Right.
But the process that Dr. Sika and us are talking about, this where we take out the blood and treat it and put it back in, it should treat all 3 of those processes because what it does is it's an anti-T cell treatment. So the graft-versus-host disease is caused by crazy T cells. ATLL is caused by crazy T cells, and the allergy thing with T cells in the skin is also kind of haywire T cells. It seems like your brother's T cells kind of went a little haywire in your body, and that's because they recognize this ain't my body. Now, could you have multiple kind of processes happen? The answer is yes, but I think Mark's right. They all condense down to the same enemy, which is that T cell. That T cell causes the inflammation in the skin. What's behind that? Is it cancer? Is it GVHD? Is it allergies? It's important to know, but the first thing is get the freaking patient feeling better.
Right.
Then figure out what it is.
So-
You know? We like to do it the other way. Figure out what it is and get them feeling better. But if we can't, the priority, I mean, when I walked in here, you looked like you were about to jump out the window. You could barely
No,
function, you know?
I'm
So we
talking
need
you
to
right now
try
and I'm in
something.
discomfort.
I know that.
My fingers, you see my fingers?
do.
They feel like, they feel like you ever been burnt by something hot and then you feel
I
it
remember
swelling?
one time you had a big, didn't you have like a big
Yeah,
swell
yeah,
there?
yeah.
And
I've
your
been
foot
through a
or
whole
something?
bunch of them stuff, man. But my hand is the worst. I can't use my hand. It gets. The only reason why it looked like it is because I had grease all over it.
Yeah, yeah.
Otherwise, it would be white and looking like this.
Hands are the most painful part
This
of the
is
body,
what.
actually.
This is.
It's
This
the
is
most painful part.
This is the most. This is the most thing that bothering me right now. This is what I really need you guys to like figure out. Why is I don't think no blood circulating. Look at, you see the skin just tearing off of the tip of my finger.
I think that's
the,
all those
yeah,
T-
looking
T
at
cells are coming in
all
there
these
and
little
there.
bump here, this right here. I'm taking some medication right now that I'm not supposed to be taking. That's why I got these. Trust me, I know my body. I've been doing this since
What medicine
2016.
is that?
That's what I'm trying to figure out my
you're
brain.
saying
I don't know.
yeah.
I'm taking the prednisone. I'm taking some other stuff, but I don't know which one of them. I know the prednisone is not supposed to cause it. It's supposed to help the immune system.
It's supposed to
But
treat it.
something else is causing me to be rashy like this. This is not the problem. This rash is gonna go away. Cause let's start already look at them. Someday they look more aggressive. Right now they're not as aggressive as they were. The problem is my fingers and my foot that you guys see.
Yes.
That this right now it feels swollen. It feels stiff. It's burning. That's what bothering me.
And we know that there are T cells in your skin from the biopsies that are attacking you. Your body is attacking your skin.
Right.
Especially those fingernails.
You see my fingernail, they
Yes,
grow up. You
that's
see,
right.
you
Because
see,
the
look,
T-cells
it's
are-
not dirty,
because
man.
the
It's
T cells
just,
are underneath there, and they're causing. It's like as if you hit it with a hammer.
all right,
Yeah,
that's how
yeah.
it feel. Like all my fingers still feel like somebody hit me with a hammer.
That's right.
I try to scratch myself.
Look, it's reacting in just the same way.
It's
It's like the nails are coming off, new nails coming underneath. So it's
So-
almost the same process.
So we know that the T cells are bad. No one's been able to prove why the T cells are bad. So what we can do is we can do a couple different things.
Yeah, let me hear what the options are.
We can call in a bunch of experts from derm, from allergy, but what they're gonna tell us is more tests, more biopsies, more of the same until we get an answer. And when it's sort of, if they don't have the answer yet, they're gonna have to do tests, and the tests might not get the answer, you know. We know that those T cells are wrong, but what's causing it? They're gonna do more and more samples, they're gonna test it again and again, and it's gonna put you through a lot more of the same. We can sit there and we can target the T cells, treat the T cells. We don't know why they're going wrong, but we know they're going wrong. So treat those T cells. That would be the electrophotophoresis. Or we say, we don't do more biopsies, we don't do more T cells. We get opinions, but we don't do any of that. We think about what this is, but we don't do either of those two, we just treat the symptoms. But then we would get you out of the hospital, we'd give you a bunch of symptomatic treatments, and we'd at least let you be in your own space, out of this place, stuck here. So that's sort of the three options, you know. We do more tests, we pull in all the different teams, we pull in allergy, and they'll probably tell us to do more biopsies. We treat the T cells directly, we knock down the T cells, then we figure out why they're going crazy. Or we sit there, we get their opinions, we get everyone to discuss it, we treat you symptomatically, we get you out of the hospital while we're waiting for that, because we're not doing anything. If we're not testing and we're not treating, then we're not being stuck here, it's just making you worse. So those are the three things it comes down to. And what direction we go is up to you, sir.
Oh my God, man.
I know.
I don't know what to tell you.
That's fair.
I don't. I'm lost for words. I don't even have a thought process in my head.
At least you're honest with yourself about that.
I don't know what to tell you, honestly.
No, that's fair.
All I need, if I could get something to calm me down from this itching, I took a pill a while ago.
Benadryl.
Yeah, but man, it seems like it turned it up more.
What
The fact-
does help you? Anything you know that you like?
I don't even know what helps.
Okay, so we have to do trial and error. We have to try
I just,
something.
if I get some steroid cream, something.
Yeah.
Something, man. Just something calm this down, guys. It's crazy, man.
That's fair.
Okay.
It's crazy.
Do you want us to pull all the experts in?
Pull in some experts, man. Let's see
All
what
right,
they could
but
do.
if they tell us
man.
biopsy, are you willing to do it?
I mean, I want to know what they're going to run the biopsy. If it's for the same thing that they done run it for, I'm not doing that. If they're going to take something and go do some other testings and other stuff, I'm willing. Like I said, y'all keep telling me, boy, it's hard to get a doctor to come and hard to get me to do the little test that I asked for, food allergy test. Nobody want to stay on that topic. Boom, he just keeps sliding. I just mentioned it, and you see how quick it just throw under the
The
table.
reason is that
It's, I want to see if we can get that done. Why
here's
can't we
the-
do that?
Because there is no such thing as that. That's the reason.
There's no such thing as food allergy.
No. It just it isn't a thing. It sort of, and I don't mean this critically. It's a phrase that would be spoken by somebody that doesn't understand the way allergy and immunology works.
Probably that's
and
why
I
I'm
don't mean
thinking
that,
like that.
disrespectfully.
Okay,
Because
I
it's
understand.
like
I'm not a
1,000
doctor.
tests.
Yeah,
Yeah,
doctor.
So sort of,
Yeah.
you could be allergic to literally anything. So when they do an allergy test, they would have to test you to everything.
But also, those kind of allergies that make you sneeze and get hot, that's not the same kind of process. But what is interesting is, it is T cell driven. So, T cells are inflammatory cells. In fact, if I hit my hand with a hammer,
Yes.
then the inflammation will come, including T cells. And there's a whole process that will result in something pretty similar to what it looks like there. And you're gonna lose those fingernails most likely. You can
Yeah,
see
yeah,
it
yeah,
growing
yeah,
up.
I
In
know,
fact,
yeah.
because
All of them, I'm
new
gonna
nails
lose
are
all
growing
of
up
them.
underneath, and it's not
exactly,
probably even the
exactly.
first time.
They are, no, they're gonna go, no.
What-
All of them is gonna go.
So when you have T cells under the skin in there, it's like every day I'm hitting you with a hammer. I gotta get those T cells out of there or to calm them down.
Right.
Otherwise, it's just gonna keep on happening over and over. We always try to know what it is first. We don't shoot first and ask questions,
That's what
right?
I'm saying.
But,
Thank you for
but,
this.
but once you're not getting someone better, and they're suffering to the point where they want to jump out the window, sometimes you have to flip the script and say, you know what?
Just try
We're not gonna stop trying to figure it out, but we can't leave the patient suffering while we dick around, excuse my French,
Right.
trying to figure out what this
I
is.
know what you're saying,
The
man.
ECP, the reason I'm kind of keen on it is, you've had like hella treatment in the past, chemotherapy that I wouldn't give to my enemy. So this is nothing like that. In fact, the worst part of this whole process is how we figure out and get a freaking IV. And the process, the treatment, it doesn't really do anything to you. It's not chemotherapy in the traditional sense. So I don't think you'll experience like tiredness or all that kind of stuff, nausea, poor appetite, hair loss isn't a problem for you. But you know, what it is tricky is, first of all, it's multiple times a week. Out as an outpatient,
I
and you have to have an
already.
IV, you know.
Right, I don't wanna do that, man.
Okay.
I already.
Okay, so that's off the table. You're saying, so that's
yeah,
off the table,
yeah,
okay.
yeah, we're not doing that.
That's why I'm glad you're saying it, because when I say to you, what do you want to do? I'm not trying to tell you to be the
I
doctor,
understand.
but I don't want to. I'm not going to go chase down 10 people to do something the patient don't want to do, right?
Because next thing I go do that and I'm still suffering with the same problem and I'm gonna feel like
But what if
That-
it works?
that's the next thing too, it could work, but that's a
You know
what if,
what's
right?
interesting about it is, if it
That's a big procedure to say what if.
well,
Not too bad.
it's not dangerous. You know what's a big procedure? Transplant. But you already been through like the hell and back. This stuff is minor. What's a drag about it is it's twice a week, and you have to go to the office or whatever up by the blood bank.
That's not a problem for
And-
me, but you know,
I wouldn't want to leave a catheter in you because we already got burned once with the port. So what we would be doing each time is putting an IV in. Your veins aren't horrible because you're a thin man, but they're not great. You already told me that.
I went downstairs, got it tested, they said they're too small to do any type of.
Angie's kind of a magician up there. She could probably do it.
Probably that's who I spoke to. She said it's my vein downstairs, they test them
I
already.
trust
And
her. I trust her a little.
they put me on the machine and they said these veins is small, so I don't know.
We don't need a big one for this, but because I just need to take it out and we can use a regular small IV.
Yeah.
All right.
So
What
we're not
else?
gonna do that blood thing. What else you guys say you're gonna bring the expert to come and take a look?
Well, they're gonna only come. I only think we should call them if we want to do another biopsy.
Like if they say we can test it for something different, but we're gonna get more samples, if they
Yeah.
wanna do more biopsies. would
Like
you be
just
willing
someone
to try?
looking with their eyes at your skin, we've been there, done that. That is not going to help us. You
They're
know,
gonna need to take tissue.
They're going to say, "Oh, I see your skin's inflamed." You're going to say, "Thank you for your expert opinion."
So you guys can't figure out what you think is it's the same
We understand. We think we understand the process, but we don't understand the cause.
And
Alright man, I don't know what to tell you guys, honestly.
All right. I'm
would you
good.
be willing to do more biopsies if they say we can test for another cause? Why are these T cells going crazy? If someone new has a new idea, a new test to run, and they need a biopsy for it, would you be willing to try it?
4 biopsy really, that does it
That's
in
fair.
2 months.
What about saying for the blood procedure? What about saying, "Listen, I'm not going to submit to months of this, but I'll do 2 weeks, or I'll do 3 or 4 treatments, and if I see it's helping me, then we'll know we're on the right track, and if I see it's not helping me, we'll stop." You know, it's not like you have to commit to months and months of that.
I appreciate
Yeah.
that, but I'm not doing it.
Okay.
Okay.
So you're not doing the biopsies, we're not doing the blood
The
test.
biopsy maybe, maybe I'll do one next, maybe, just maybe, I'm not sure right now. 'Cause my head
Yeah,
is
we
like
could
a
probably
test.
send you
Maybe,
to an outpatient.
maybe,
Then
Maybe,
Then
man,
maybe
I'm
we
not
sit there and we load you up with a bunch of treatments. We
yeah,
give you a bunch
give me all
of
type
things.
of treatment, I go
Get
home.
you everything,
Yeah.
you go
You know
home,
what?
and we make you appointments with allergy, with
Yeah.
derm in their offices.
Yeah.
They can sell you on the biopsy, you've got time to think about it, you can say no, go out of their office, go home. Or you
Yeah.
can say yes, if they give you a good pitch, they say, I wanna do this biopsy for this reason, you say yes,
That
and
makes
we
sense
send
to
you
me.
home with a whole bunch of meds, and instead of being stuck here, you're getting all the same things you're getting here, but in your own space, your own home, where you're not bothered, you're
Yeah,
not
I'll
called.
do that. Give
Okay,
me, give me
alright.
all the thing you could get me and I'm leaving today,
Okay.
man.
That's a
I'm
plan.
I think it's a good
Um,
decision.
I can't sit here and you guys can't treat me, that don't make no sense.
Completely fair, we agree.
Can I ask you a crazy question? Out of the blue question. Did you ever try sunlight?
Sunlight?
Yeah.
The sun? Natural sun?
Yeah.
Man, that's all I do, man. That's why I'm still here, man.
It's not helping
I just
you?
go sit in the sun.
When
like
you
this.
do it, do you feel it helps you or no?
Yeah, cause I get vitamin D from the sun.
But does
so
it calm the inflammation or not so much?
Yeah, it does. It better than being in a cold. If you notice, I have to put towel over on this guy. It's so cold in here, man, and it make me worse.
Okay.
Sometimes for CTCL, natural sunlight is actually beneficial. You do narrowband UVB mostly, but okay.
I was misled though. They mislead me with my sickness here. They tell me first, you're the only person in the world with this disease. I'm telling you what I
No,
was
I know,
told.
I'm laughing because I've heard
Right.
it from multiple people also.
Right. Then they come back and they tell me, oh no, it's not the only person in the world. We've seen this disease in China and maybe in China.
It just sort of
So
all the pieces. Sorry, I didn't mean to interrupt you. You continue. I'm
that's
sorry.
all the guys doing. Every time I
Sorry,
talk, I ain't got
sorry.
nothing more to say. Man. Done.
Let's see if we can get you something right away for your
Please.
skin. I think calamine might soothe a little. It's not going to be great, but.
Whatever you could think of that help people with itchy skin.
Also, the Benadryl, did you ever try hydroxyzine, Atarax? It's a
I don't know
little
what
better
that
for
is.
itching than Benadryl.
I don't know what
We'll
that
switch
is.
it up. Yeah.
I don't know which one is stronger.
Atarax.
Oh,
And we'll go for it.
Yeah. They both make you tired, but
I
Benadryl
don't
is
care about being tired. I care about not after we worry about this.
this one's a little better, and it's a pill.
And
you
then
can
you
take
can
it
see
with
my
one.
hand. I can't even hitch myself. You see my hand? I can't.
So we will load you up with all the treatments we can think of. We'll make you a bunch of appointments with the experts. But if we're not, and then you'll see them. And if they give you, we'll think about the biopsies. We'll think about further testing. But if you don't, that way you can meet all of them and decide on a case by case. Your case is difficult because every piece of it has been seen before. Your combination is bizarre, you know.
Yeah.
Sort of all this doesn't happen to one person typically.
I just been misled with my case, man. A whole bunch of things I heard with my case. Like, I know you guys really don't know what's going on.
We don't know the cause.
I was told I'm the only person. I was told I'm like in America right now. I'm the only one in America right now with this case.
That might be true.
That's what I was told like 2 days ago. I'm the only person in America with my case. So this case is like on the table. Nobody even knows. I bet none of you guys know that. You didn't know that. For a fact that I'm the only case in America.
Can I speak?
Go ahead, man.
Okay. So, you're right. And I just want to make it clear so that we're not confusing, because sometimes we say something and it gets misinterpreted. Other people have ATLM. Other people have T cells in their body, their blood, their skin. Other people get bone marrow transplants. But has anyone else gotten all the individual things that you've gotten? Is anyone's case as complex as yours? That I don't know. You're the only person in America who I've ever heard of who had all the individual pieces. And that's why everyone's so difficult, what's the cause? Because there's so many causes it could be. So I don't want you to sit there and think, I'm the only person who's ever had this cancer. I'm the only person who's ever had this treatment. I'm number one, I'm the first, they're experiment. That's not true.
So I was lied to.
No, I think it was the
but
way
all
they
the
said it,
details,
yeah.
all the details.
So I
essentially-
was lied to then. I was misled then. You just now explaining it the right way. What is it? I don't know.
But it's just sort of all the pieces. Other people have had this cancer before, but has everyone had every single step that you've had? No. So, the other people who've had this cancer and had the bone marrow biopsy, did they get it again? Not many of them. Did they get the same rash as you? Not many of them. Did they get the
So
same?
some of them did get what I get?
Yes.
How did they actually?
So that's why they did the biopsy. That's why they did it,
Then
because
how did the people get treated?
So it depended on what they showed. Some people it was the cancer in their skin. Other people it was the graft versus host disease.
Right.
And
But-
depending on which one it was, it's different.
But that's why my case is the only case, because you tell me you mentioned two different stuff and mine is 2 in 1. That's the
Exactly.
complication. So what if it's none of those 2 in 1? What would you say?
Then I'd say we need to treat the T cells even if we don't know why they're doing wrong. We know that the T cells are messed up. I can't tell you why they are.
Right. And there's no drugs to calm them down.
That's what we're trying to do with
And that's what the prednisone supposed to do.
It is.
So why is it not doing that?
Because it's not enough.
Your T cells are too hyped up right now for prednisone alone. It works in the beginning sometimes, but after
Yeah, it
someone
did
tells
work,
us
guys.
we're
When I started taking
You're
it,
resistant to it now.
right. So I should stop taking that, guys.
If it's not helping at
It's
all,
not helping at
then
all.
it's only causing toxicity.
That's all they're doing to me right
Okay,
now.
so we can't abruptly stop it. We have to take
But no,
it.
I got it.
Yeah.
I start.
If it really is doing nothing,
It's
then
not
we should
doing
take.
anything.
Then we
It
have
just stop-
to.
it stop
Then it's just
working.
gonna make your body weak.
Yeah, it stopped working. I'm telling
Okay.
you, it stopped working.
And that's why we wanted to.
Like
offer
it
you
did
some-
help. It helped in the first.
Yeah,
that's how I
what
get.
always
That's
happens.
how
It works
I
for
got
a few months and then.
that this stuff took in the first place. It did work in the first.
But it was short lived.
Yeah, it was short lived.